Dear viewers, in today's discussion, I want to share with you the most important vitamins involved in preventing hair loss, while also explaining why so many women begin to lose their hair and what the real underlying causes actually are. Because alongside this conversation, we also need to talk honestly about how fear and confusion are often used to promote so-called miracle hair growth products, allowing the cosmetic industry to profit enormously from women's concerns. In this video, we will explore how hair loss actually develops and what you need to understand in order to slow it down and prevent it, because hair is not simply a cosmetic feature, but a sensitive biological indicator of overall health. Each strand follows tightly regulated cycles of growth, rest, and shedding, controlled by hormones, nutrients, and cellular energy, which is why changes in hair density often reflect deeper imbalances, especially after menopause. Hair loss can be diffuse or patchy, and its emotional impact is profound feeding stress that worsens the problem. If this topic resonates with you, subscribe to the channel and comment the country you're watching from so I can see how far this message is reaching, and stay until the end because I have a small but important surprise for you, starting with how the body signals hair loss long before it becomes visible. 1. Hair as a biological marker of whole body health. Before hair loss becomes something you can measure in the shower drain or see in the mirror, it almost always begins as a silent shift inside the body, which is why experienced clinicians rarely view thinning hair as an isolated cosmetic complaint, but rather as an early biological signal that the internal environment supporting the hair follicle has changed. Hair follicles are among the most metabolically active structures in the body, requiring a continuous supply of oxygen, amino acids, micronutrients, and hormonal signals in order to sustain normal growth. And when any one of these inputs becomes inconsistent, the follicle responds quickly and visibly. From a medical perspective, hair behaves much like a diagnostic surface, quietly reflecting what is happening beneath it long before more obvious symptoms appear. Subtle disturbances in estrogen, thyroid hormones, cortisol, or insulin signaling can alter the timing and strength of the hair growth cycle, while chronic inflammation and nutritional depletion reduce the follicle's ability to produce strong, resilient strands. This is why hair density often changes months before women recognize fatigue, sleep disruption, or metabolic slowdown, particularly during the years following menopause when hormonal regulation becomes less stable and nutrient demands increase. What makes hair loss especially distressing for women is not only the physical change, but the emotional meaning attached to it, because hair has long been associated with identity, vitality, and femininity. As shedding increases, stress levels rise, and this stress is not merely psychological, since elevated stress hormones can further disrupt follicle signaling, creating a self-perpetuating cycle in which internal imbalance and visible hair thinning reinforce one another. Over time, this cycle can erode confidence and produce a sense of losing control over one's own body, even when the underlying issue is biological rather than personal failure. Clinically, it is also important to understand that hair loss does not present in a single uniform pattern. Some women experience diffuse thinning across the scalp, while others notice localized areas of reduced density, and both patterns often point to different internal stressors acting simultaneously rather than a single external cause. When hair is viewed through this broader biological lens, it becomes clear that restoring hair health begins with understanding what the body is signaling, which naturally leads us to examine how hair growth is regulated at the cellular level and when normal shedding quietly crosses into imbalance. 2. The hair growth cycle and when hair loss becomes abnormal. To understand why hair thinning becomes noticeable long before it feels alarming, it helps to look closely at how hair is biologically programmed to grow, pause, and renew. Because hair loss is rarely sudden, even when it appears that way on the surface. Each follicle follows a tightly regulated cycle composed of 3 distinct phases, beginning with an active growth phase, in which the hair shaft is continuously produced, followed by a short transitional phase where growth slows, and finally a resting phase in which the strand is released to make room for the next cycle. Under stable conditions, these phases are carefully synchronized across the scalp, allowing hair density to appear consistent and balanced. In a healthy system, the majority of hair follicles remain in the active growth phase for several years, while only a smaller proportion rests at any given time, which is why a daily loss of hair is both expected and physiologically normal. What often confuses women is that the visible shedding they notice today does not reflect what happened yesterday, but rather what occurred within the follicle months earlier, when internal signals quietly shifted and altered the timing of the cycle. This delayed response is one of the reasons hair loss can feel unpredictable, even though it follows precise biological rules. When the body experiences sustained stress, hormonal disruption, inflammatory activity, or nutritional insufficiency, a larger number of follicles can be pushed prematurely into the resting phase, leading to a pattern of diffuse thinning that gradually becomes visible across the scalp. In other cases, specific immune or metabolic disturbances may affect clusters of follicles, producing more localized areas of loss. These patterns are not random, and they often provide important clues about whether the imbalance is systemic, hormonal, or immune-related, particularly in women navigating the postmenopausal years. What makes abnormal hair loss so emotionally unsettling is that the process unfolds quietly, often without pain or warning, until the cumulative effect becomes impossible to ignore. By the time shedding feels excessive, the biological shift has already been underway for some time, reinforcing the importance of understanding what the hair cycle is responding to, rather than reacting only to what is falling out. Once this distinction becomes clear, it naturally raises a deeper question about which internal pressures most commonly disrupt the cycle in women after 50, and why these factors tend to intensify during this stage of life. 3. The root causes of hair loss in women after 50. Once the hair growth cycle becomes disrupted, the next step is understanding why this disruption grows more frequent and persistent in women after 50. Because at this stage of life, hair loss is rarely driven by a single factor acting alone. Instead, it reflects the gradual convergence of several internal pressures that weaken the follicle's ability to sustain normal growth. Clinically, the most influential of these pressures is hormonal change, particularly the decline and fluctuation of estrogen, which plays a key role in maintaining follicle signaling scalp circulation and the length of the active growth phase. As estrogen levels fall during and after menopause, the protective influence it once provided diminishes, leaving follicles more vulnerable to stress hormones, inflammatory signals, and metabolic instability. Thyroid function also becomes increasingly relevant, since even mild disruptions in thyroid hormones can slow follicle activity and push hair prematurely into the resting phase, often appearing as diffuse thinning rather than sudden shedding. These hormonal shifts rarely occur in isolation, but interact closely with other physiological systems that influence hair health. Chronic stress is another major contributor, particularly when it becomes prolonged rather than temporary. Elevated cortisol levels can interfere with nutrient delivery, disrupt insulin signaling, and intensify inflammatory pathways, all of which reduce the follicle's capacity to maintain growth. What often confuses women is the delay between cause and effect, since stress-related hair loss typically appears months after emotional strain, illness, or major life changes, making the connection easy to overlook. Nutritional depletion further compounds these effects, especially in women who have relied on highly processed diets for many years, or who take long-term medications that impair nutrient absorption. Deficiencies in essential vitamins and minerals can develop quietly, weakening keratin production and follicle structure without obvious early symptoms. Over time, the follicle becomes fragile, responding to even minor stressors with shedding rather than regeneration. If any of this feels familiar, comment 1 if you recognize these patterns in your own experience, or 0 if hair loss has appeared without an obvious explanation, because understanding where you are in this process helps clarify what your body may be signaling. When these root causes are viewed together, hair loss after 50 begins to look less like an isolated scalp issue and more like a biological response to cumulative internal strain, which naturally brings us to what the follicle truly requires in order to regain stability and resilience. 4. The 3 foundational vitamins for hair health in mature women. When the body begins to signal hair thinning, the most effective response is not to search for stimulation, but to restore the biological conditions that allow follicles to function normally, because without the right internal support, even a healthy follicle cannot sustain growth. From a clinical standpoint, this support rests on a small group of foundational vitamins that influence keratin production, cellular protection, and follicle signaling, particularly in women after 50, when absorption hormone balance and metabolic efficiency quietly change. The first of these foundations is the vitamin B complex, with biotin and pantothenic acid playing especially important roles in hair biology. Biotin is directly involved in keratin synthesis, the structural protein that gives hair its strength and elasticity, while pantothenic acid supports cellular energy metabolism and the body's stress response, both of which are critical for maintaining an active growth phase. As women age, digestive efficiency and protein utilization often decline, which can reduce the availability of these B vitamins at the follicle level, even when intake appears adequate. When B vitamin status falls, hair strands gradually become finer and less resilient, reflecting weakened structural support rather than external damage. Vitamin C forms the second pillar of internal hair support, not because it directly grows hair, but because it protects the environment in which hair grows. As a powerful antioxidant, vitamin C helps limit oxidative stress that can damage follicle cells, while also playing an essential role in collagen synthesis, which maintains the connective tissue surrounding each follicle. Over time, low vitamin C status can subtly impair microcirculation and iron absorption, reducing oxygen delivery to the scalp and making follicles more vulnerable to stress-related shedding, especially in postmenopausal women. The third foundational vitamin is vitamin D, which functions more like a hormone than a traditional nutrient and has a direct influence on hair follicle activity. Vitamin D receptors are present within the follicle, and when these receptors are inadequately activated, the transition from resting to active growth becomes less efficient. In mature women, reduced sun exposure, changes in skin synthesis, and immune shifts all contribute to deficiency, which may explain why vitamin D status is so closely linked to diffuse thinning and delayed regrowth during this stage of life. In clinical practice, these deficiencies rarely appear alone, and it is common to see partial insufficiencies across all 3 vitamins, creating a compounded effect where follicles struggle not because one signal is missing, but because the biological conversation guiding growth has gradually weakened over time. What is often misunderstood is that these vitamins do not work as isolated triggers, nor do higher doses automatically produce better outcomes. Their role is to restore the baseline conditions that allow follicles to respond appropriately to growth signals, stress recovery, and hormonal regulation. Once this foundation is in place, it becomes easier to understand why external products alone cannot compensate for internal deficiencies and why lasting hair recovery depends on supporting the follicle from within before addressing anything applied to the scalp. 5. Why shampoos, serums, and ampules fail to fix hair loss long-term. Once the internal foundations of hair health are understood, it becomes easier to see why so many topical solutions fall short, even when they appear convincing at first, because most products designed for hair loss are built to change how hair looks, not how follicles function. From a medical perspective, the limitation of shampoos, serums, and ampules lies in the depth at which hair loss actually occurs, since the follicle is a living structure embedded within the skin and regulated by systemic signals that cannot be meaningfully altered at the surface. Many shampoos marketed for thinning hair rely on aggressive cleansing agents that strip natural oils from the scalp, creating an immediate sensation of cleanliness and volume, while quietly disrupting the lipid barrier that protects follicle openings. Although hair may feel lighter and appear fuller after washing, repeated exposure to these detergents can leave the scalp more vulnerable to irritation and inflammation conditions that weaken follicle signaling over time rather than restoring it. Similarly, silicone-based ingredients coat the hair shaft to produce shine and thickness, yet this coating does nothing to strengthen the follicle itself and may even interfere with the scalp's natural balance when used continuously. Serums and ampules often go a step further by adding ingredients that stimulate short-term circulation or create a cooling sensation, which can feel reassuring to someone anxious about shedding. While increased blood flow at the surface may briefly enhance comfort or appearance, these effects are temporary and do not address the hormonal, nutritional, or metabolic factors that determine whether a follicle remains in its growth phase. In clinical terms, stimulation without biological support is unsustainable because follicles cannot respond to signals they lack the internal resources to process. Medicated topical treatments follow a similar pattern, offering conditional improvement rather than resolution. Some can encourage temporary regrowth by altering local signaling pathways, but their effect depends entirely on continued use, and once removed, follicles often revert to their prior state. This creates a cycle in which appearance improves only as long as the product is applied, reinforcing dependency without rebuilding the follicle's natural resilience. The underlying issue is not that topical products are useless, but that they are frequently asked to perform a role they were never designed to fulfill. When internal deficiencies, hormonal shifts, and chronic stress remain unaddressed, no external formula can compensate for the absence of biological support. Understanding this distinction clarifies why long-term hair recovery requires restoring internal balance, first and only then, evaluating how surface care fits into a broader, more sustainable approach. 6. The inside-out principle of sustainable hair recovery. When women begin to step away from surface solutions and look more closely at what truly supports hair growth, a clearer pattern emerges, one that experienced physicians recognize across many areas of health, because hair does not recover through stimulation alone, but through restoration. The follicle is not a passive structure waiting to be activated, but a metabolically demanding organ that responds continuously to signals coming from within the body, including oxygen availability, nutrient supply, hormonal balance, and cellular energy. When these signals are inconsistent or weakened, the follicle adapts by conserving resources, often by shortening the growth phase and releasing hair earlier than expected. This is why sustainable hair recovery must be approached from the inside out, rather than from the scalp downward. Internal nourishment determines whether the follicle has the capacity to respond to growth signals in the first place, because without adequate building blocks, even the most favorable external conditions cannot sustain regeneration. Protein intake influences keratin production, micronutrients guide enzymatic processes, and balanced blood flow ensures that these resources actually reach the follicle. When any part of this internal support system is compromised, hair growth becomes fragile, easily disrupted by stress, illness, or hormonal fluctuation. Hormonal signaling plays a particularly central role in this process, especially after 50, when the body's regulatory systems no longer operate with the same consistency they once did. Estrogen, thyroid hormones, insulin, and cortisol all influence how follicles interpret growth and rest signals. And when these messages become distorted, the follicle often responds defensively rather than productively. This response is not a failure of the follicle itself, but an adaptive mechanism designed to protect the body during perceived imbalance, even though the visible result can feel alarming. What is often overlooked is that restoring internal balance does not happen through a single intervention, but through cumulative physiological support. Sleep quality affects hormonal repair, stress, regulation influences, inflammatory pathways, and digestive efficiency determines how well nutrients are absorbed and utilized. When these systems begin to function more harmoniously, follicles are gradually exposed to a more stable internal environment, one that favors longer growth cycles and stronger hair production over time. This perspective reframes hair recovery as a process of rebuilding resilience rather than forcing results, emphasizing patience and consistency over quick fixes. Once this principle is understood, it becomes easier to evaluate supplements and interventions more critically, recognizing that their value depends not on promises of rapid change, but on how well they support the body's ability to restore balance from within. 7. Supplement caution, quality absorption, and realistic expectations. As women turn towards supplements in hopes of supporting hair recovery, it becomes essential to approach this step with discernment rather than urgency, because not all supplements are created with the same biological intent or effectiveness. From a clinical perspective, supplementation is meant to correct deficiencies and support physiological processes, not to override the body's regulatory systems or force rapid outcomes. When this distinction is overlooked, supplements can easily become another surface solution, offering reassurance without delivering meaningful support at the follicle level. One of the most common challenges with supplements lies in quality and bioavailability. Many products contain forms of vitamins and minerals that are poorly absorbed, inadequately dosed, or combined in ways that compete for uptake in the digestive tract. In mature women, this issue is amplified by age-related changes in digestion and metabolism, which can reduce the body's ability to extract and utilize nutrients even when intake appears sufficient. As a result, a supplement may look comprehensive on a label while contributing very little to actual follicle nourishment. Equally important is the understanding that supplementation cannot compensate for foundational imbalances. Vitamins and minerals rely on adequate protein intake, healthy digestive function, and stable blood flow in order to reach their target tissues. When sleep deprivation, chronic stress, or metabolic dysfunction remain unaddressed, supplements often deliver diminishing returns, not because they are ineffective, but because the internal environment is not prepared to use them efficiently. In these cases, increasing doses rarely improves results and may instead introduce unnecessary strain on regulatory systems. There is also a tendency to expect visible improvement within weeks, which does not align with the biology of hair growth. Follicles operate on long cycles, and meaningful change reflects conditions that were present months earlier rather than days before. Supplements that genuinely support hair health work, gradually reinforcing internal stability over time, rather than producing immediate cosmetic effects. When expectations are set too high or timelines are misunderstood, women may abandon supportive strategies prematurely, assuming they have failed when the body is still in the process of adjusting. Ultimately, supplements should be viewed as tools rather than solutions, valuable only when chosen thoughtfully and used within a broader framework of nourishment, hormonal balance, and stress regulation. When this perspective is maintained, supplementation becomes a supportive element in sustainable hair recovery, rather than another promise that distracts from the deeper work of restoring the body's internal equilibrium. In practice, this means choosing supplements with transparent sourcing, using forms the body can realistically absorb, and allowing enough time for internal conditions to shift, because hair recovery reflects cumulative biological change rather than isolated nutritional input or short-term correction. Hair loss after 50 is rarely a problem that begins at the scalp, and as we have seen throughout this discussion, it is far more often the result of cumulative changes in hormones, nutrition, stress, and internal balance that quietly shape how follicles behave over time. When hair is understood as a biological signal rather than a cosmetic failure, the path forward becomes clearer because lasting improvement comes from restoring the conditions the body needs to sustain growth, not from forcing quick results. My advice is to step back, look at your overall health with patience and curiosity, and give your body the time and consistent support it needs to respond. If you found this information helpful and would like to support the continued creation of calm, science-based content for women like you, you're welcome to donate in whatever amount feels comfortable, as it truly helps this channel grow and reach more people. And before you go, please like this video, share it with someone who may need it. Subscribe to the channel, and thank you sincerely for spending this time with me and trusting me with your health journey.